How's it going? This is Shaw with Osana. I just wanted to take a quick moment to share with you a story that we just got back. Our partners at the Invictus Initiative, the invictus.org, you can check it out. They just got back from Brazil not too long ago, and we had sent some bars down to them, and they had the chance to integrate the bars into a pregnancy center. And we had the chance to catch up with our buddy Mike, and he's going to just tell you a little about the Invictus and also what they were able to do with Osana because of you, because of your purchases, and because of you guys joining us in the battle to help eliminate preventable death caused by malaria, dengue, other mosquito-borne illnesses and disease, and sanitation-based illness. So thank you and enjoy the story.
So basically, Invictus Initiative went to Brazil in March of 2016. We partnered with Osana on one of our initiatives, which was the anti-Zika initiative. Invictus has been working in Rio for about 3 or 4 years now, working in a community that is a favela community, which is another word for shanty town. It's usually the houses that are built up on the mountaintops areas of Brazil, the hill areas of Brazil. And basically, the name of the community, the favela community, is called Complexo del Amal. You know, we've had a window to really come in, build relationships, work on a number of projects in engineering, agriculture, education, and business. And it's been really cool to build relationships with people in the favelas, expose them to opportunities that maybe they wouldn't have known about, and just giving them an opportunity to dream big and empower them with the tools to be successful, right? That's the goal. So many people have heard that Zika has been a huge threat in Brazil and other Central and South American countries, and something's got to be done. So, you know, naturally, since Invictus Initiative is going into this area and we've built relationships there, you know, we wanted to help out any way we can. So what we did is we partnered with Osana Soap to kind of put together a kit for these women. The kit has kind of some information on Zika and its effects. It also has, you know, mosquito nets that they can put around their beds at night to prevent the mosquitoes from getting in. It also has the Osana soap. So, you know, we wanted to give these out to empower 50 families. So 50 expecting mothers that are at some point in their pregnancy where they want to start using the soap and the nets. And you know, the big thing I should say is that we did a lot of interviews and we saw what Brazil was already doing to the people there as far as education goes. And there is a thing called Zika Zero, which is a huge campaign. But what we found with our interviews is that a lot of people kind of treat it as one of those things, well, we know it's an issue, but we're really not going to do anything about it until it affects us directly. So you've got a lot of families that know the threat, but really aren't doing anything about it. To partner with a company like Osana Soap and actually, you know, put together a kit that can actually physically do something about it is a huge benefit. And it's something that the local communities are actually willing to adapt. So what we did is we met with different health professionals. We met with different community leaders. And after understanding what's being done, we started to uncover what needs to be done. And for us, the big thing was distributing the soap, the bed nets, additional information, really working with these families to empower them to protect themselves from the Zika threat. We created a really cool system with the local community, and there's really 3 parts. The first is the local health professionals that we met with that are already meeting with expecting mothers, and we've set up a system where they write a prescription to the expecting mothers for the Zika kits, anti-Zika kits. And what these mothers will do is they'll go to the community center, they'll connect with one of our partners within the community center, which we've done a number of different projects with. There's a really great lady named Chiabechi, and Chiabechi will basically supply them with enough soap for the remainder of their pregnancy. What's cool is because we don't ever give anything out for free, and there's a lot of data showing that with pharmaceuticals or any kind of health product, if you give something away for free, a lot of times people don't think there's any that it actually works. They don't think there's any value behind it because they didn't pay anything for it. So maybe it doesn't work. Or if they do think it works, it probably doesn't work that well. So like you'll get a bunch of overdoses in developing countries from medical brigades that come in and distribute pharmaceuticals. People don't pay for them, so they're like, well, they instructed me to take one a day. I'll probably take 5 just because I don't think it works because I didn't pay anything for it. So there's a lot of value in charging people for stuff. So with the soap, we identified what the local price was for random soap that they were already using. That came out to be about $1.25. So we priced the soap for $1.25. The cool thing is these mothers bring their prescription in, pay the $1.25 per bar of soap, and get their kit. 100% of the proceeds go back into the community center, and the community center reaches out to youth, it reaches out to adults, it has educational programming, it has opportunities for young people to vet their energy in creative legal ways, which is cool. So the community center is great. So the ability to sell Osana soap in a correct way to families that need it, as well as generate revenue for a community center that is providing a ton of value and is a huge asset for the local community. It's just a win-win for everybody. So 3 parts: the health professionals, the community center, and the expecting mothers. They're all kind of serving themselves, which is great. Our goal is to head back to Rio de Janeiro in November for a follow-up trip where we'll work on a number of initiatives in agriculture, business, and of course this health initiative where we'll actually follow up with the parents, the expecting mothers, the families, and a part of that is collecting all the data from the community center sides. Thank you, Osana Soap, for helping Invictus Initiative with building our relationships and providing value for the people of Brazil.